Hey y'all, welcome to The Skintrovert. I'm your host, Sam Bazile. And let me tell you something. Exfoliation needs a damn PR team. And I am going to head that PR team today. We have got to get some clarification on what you guys are doing out there when it comes to exfoliation. Now, because there's always freaking misinformation on the internet, we know that. Surprisingly, I'm also seeing misinformation in actual providers' offices. Now, I don't think it's necessarily always incorrect or wrong information. What I think it is maybe telling half truth or half the story, not the full story. And like it or not, skin health is skin health. Okay. So maybe as a provider, you were mentored by someone that was afraid of exfoliation. So you now are afraid of exfoliation. Or maybe you're a provider that went to an esthetician that was scared to exfoliate. So they made you scared to exfoliate. This is why exfoliation needs a damn PR team, because someone has to bring all of you back down to reality, bring you to the basics of skin health. And I am just the person to do that. Okay, at least today I'm the person to do that. So let's do that. Now, if you are going to truly understand exfoliation, you've got to understand when to do it, how to do it, the frequency of doing it. There really is a lot that comes to it. So, Sam, what do we do then? If there's different ways to exfoliate, if there's different frequencies to it, how do I know what's right for me? Well, I'm going to say this again, and I feel like I need to just tattoo this on my damn forehead because I feel like I say it every single episode. If you are a patient watching or listening to this podcast, you should never go it alone. Period. You should find a provider that you trust that can guide you on your exfoliation journey, because can it go wrong? Abso-freaking-lutely. So you need someone to guide you. But also, if you're someone who is confident and you're experienced and you're educated in your exfoliation journey, guess what, babes? Your needs are going to change. Seasons change, hormones change. There's going to be times in your life where you're going to need to switch it up. So it's always good to have someone to guide you on that journey that's truly really smart, that gets you and gets your skin. So that disclaimer is out. Now let's go forward. Let's say you're a provider listening or watching this podcast, and maybe you understand exfoliation a little bit, but again, someone out there made you so scared to exfoliate, and now you're not translating that to your patients, and you're forgetting about the actual rejuvenation of the skin and how to get it healthy. No worries, I got you. So let's do it. Let's dive into all of that juice today. By the time you are done with this podcast, I truly hope that you have a very healthy respect and understanding for exfoliation, because it is absolutely needed. Guys, exfoliation is healthy. You know what? When you were babies, your skin exfoliated very rapidly, very naturally on its own. That's why your skin looks so dang good when you were a baby. So bringing exfoliation back is healthy. And why do we need to bring it back if we exfoliated on our own when we were babies? Why are we not doing it as adults? Because we age, because we have hormones, because we have environmental issues. There's all kinds of issues, which we are going to talk about, of what can delay that exfoliation cycle. In short, everything slows down. We are aging. We are in an aging world. So if everything is slowing down, well, I don't know about you, but I want to speed it up. And that's what we need to do, but we need to do it right. So if you're going to understand exfoliation, sadly, I think you need to understand the science of the skin. And when it comes to exfoliation, we are targeting specifically the epidermal layer. That's the top layer of the skin. It's what we see, touch, feel, okay? And some people think it's just made up of a bunch of dead skin cells and it has no purpose. Wrong. Every single layer of that epidermis has a function, has a purpose, and you need to understand it to adequately treat and guide your patients on exfoliation. So let's dive in. So that top layer, okay, that epidermal layer, it's made up of 5 layers in the palms of the hands and the soles of the feet. The rest of the skin, it's going to be 4 layers. I'm going to bring up all 5 just for the sake of learning. And let me tell you, okay, little disclaimer here. It's been a hot minute since your girl has been in SD school. So yes, I have notes, and don't be coming at me like, oh, you pronounce that wrong. I don't care. Okay, I don't care to hear your negativity. All right, I have no time for that today. Today, I have a job, and that's to be the exfoliation PR team, not to be your pronunciation guru. Okay? Okay. So let's dive in. All right, first, I'm going to start from the top, the layer that you see, touch, feel, and work my way down. So the top, that's the stratum corneum, otherwise known as the horny layer. So that layer is made up of dead, flat, keratin-filled cells. Those cells are enveloped in a lipid barrier. So that lipid barrier consists of things like fatty acids, lipids, proteins, water. Those things kind of hold those cells together. And yes, even though they are dead, flat cells, they are kind of serving a little bit of a purpose. They are protecting the skin. So that's the purpose of the stratum corneum. Underneath that, stratum lucidum, that is the clear layer. That is the layer that is only present in the soles and the soles of the feet and the palms of the hands. Okay. That is a very thick layer, clear layer that you're going to see in the palms and the soles. Okay. Other than that, underneath there, we have the stratum granulosum, or the granular layer. This is the keratin producing cells that lose their nuclei. So remember, they're flattened out at the top, but as we start to move down, they get more and more filled and more juicy. So here we've got the keratin in there, and they're losing their nuclei. Underneath that, you have the stratum spinosum, otherwise known as the prickle cell layer. This is where the desmosomes are present. So the desmosomes are those little linking things that hold the cells together. I can't believe I said things, but that's how my brain works. Okay. Those are the things that hold the cells together. And as they mature, as they flatten, those desmosomes kind of loosen and help the skin to exfoliate away. But this is where those desmosomes are present in the prickle cell layer. And when those desmosomes are present, that's when the skin, the part of that layer of skin, has more flexibility and more movement. Now, the very last layer, the stratum basale, or the basal layer. So this is where those new cells are born, okay? Also, this is where your melanocytes are, those pigment producing cells. Now, your skin is constantly renewing itself through this process called desquamation. So when those cells at the top flake, fall off, die, that's called desquamation, exfoliation. And unfortunately, there are things that happen that slow that down, but you don't want to slow it down. You want to make sure that your cells are adequately exfoliating, because if you don't, you're not going to have the regeneration and the rebirth of those new cells down in that basal layer. So it's all part of the life cycle of these cells. And when things slow down, when those cells become more packed and flattened on the skin, you start to see things that you don't love. You see aging, you see the buildup, you see congestion. And if you are genetically acne prone, you're going to see acne. You're going to see rosacea. You're going to see more inflammation in the skin. So there are reasons that exfoliation naturally slows down or stops. Several different reasons, and it can be different for all patients. One of the reasons is aging. Like I said, we are in an aging world. That's not something we can stop. So the slowdown of that exfoliation is going to happen no matter what. Even if you genetically have wonderful, healthy, beautiful skin, that process is going to slow down, which is more the reason that I feel like we need to bring it back. So why does aging affect exfoliation? Because when you age, that turnover, the rebirth of cells, the maturation, the flake off and die, that all slows down as we age. So if it's slowing down, the cells are starting to become more compact, they're not exfoliating away, and you're going to have buildup, congestion, acne. Another issue for the slowdown, sun damage. So what happens is UV triggers inflammation. This can also disrupt your skin barrier, which delays exfoliation. Another issue, dry skin. Dry skin is an issue for exfoliation because without proper moisture, without proper lipids, those dead skin cells build up on the surface, and that causes a delay in exfoliation. What's another thing, Sam? Hormonal changes. Hormonal changes, like maybe a drop in estrogen, that can reduce the lipids, make the skin drier. Okay, also slowing that down, right? It's all connected. There are also other certain medications that can kind of slow things down, and this can be different with every medication. So this is just kind of like a blanket, but some can affect oil production. We've talked about this before, but oil is very sticky, waxy, thicky. So it acts like glue. So if a medication increases that oil production, then you're going to have more glue, like glue substance, that's going to hold those skin cells on and stick them on. Also, some medications can just alter the shedding process altogether. So different medications, different issues, but medications are an issue for the slowdown. Another issue for the slowdown, inflammation. Inflammation disrupts that natural shedding process in the skin, okay? Or I should say, it can cause the production of more skin cells, more buildup, more congestion. So inflammation is a little pesky, problem that we don't normally always address, which is why you got to put the fire out or fight the fire with fire. And lastly, genetics. Genetics can absolutely cause a slowdown in exfoliation. Simply put, some people are just genetically predisposed to skin that is drier, or they produce too much keratin, or maybe they have too much oil. All of these things can lead to faster turnover or buildup. So it's going to happen, guys. You're going to have a slower exfoliation and you're not going to shed those cells naturally. And when you don't, if you just leave it all on there and you don't address it, what can happen to your skin if you just leave all those cells there? Skin becomes rough, aged, dull, congested, uneven in tone, more breakouts, less receptive to your skincare products. So if you're like, I know these products are good, I see that these products have great reviews, people are getting results, I'm not seeing anything, it's probably because you got a lot of dead skin cells blocking it and it's not penetrating. Just saying. Okay. So what happens if I don't exfoliate it? Exfoliate. Think of it like leaves piled up on a lawn. Okay. One leaf is not the problem, but think of months of leaves that just fall down on this lawn. And then you have rain, okay? You have other weather things, people stepping on it and piling on it. I want you to think of that rain as like you just moisturizing, okay? You got all these dead skin cells and all you're doing is slapping on a moisturizer, okay? It's just like these leaves becoming wet, sticky, impacted. It's like a thick mat that blocks everything underneath. And excess skin cells can trap oil, they can trap bacteria, they can trap pigment, make pores appear larger, okay? Prevent ingredients from penetrating, okay? Cause makeup to sit poorly. But more importantly than everything that I just mentioned, it prevents the rebirth and regeneration of new healthy cells. We want new cells to constantly be born in that basal layer because remember, that regeneration triggers new healthy cells. So if we're constantly build up, and we're not sweeping them away or exfoliating them away, we are not producing healthy new cells adequately like we should. And then the skin just starts to look aged, rough, dull, and not pretty, not healthy. Okay. So what do we do, Sam? Okay. Because my esthetician told me that I shouldn't be using that exfoliant scrub, or I shouldn't be using the glycolic acid, or I shouldn't be using that. First of all, that's incorrect. You have to exfoliate. But here's the thing, and this is where some people get it wrong. Instead of understanding that not all exfoliation is created equally, they just straight up are scared of it. Okay. They straight up stay away from it, or they avoid one type of exfoliation and just push one. No, there are different types of exfoliation because not everyone needs the same. Not everyone needs it as frequently. You might have patients that need both and they need it every day. And yes, I said it every day. Understand that this skin here, she takes physical exfoliation every day. She takes chemical exfoliation every day. And I am not even embarrassed or ashamed. I'll sing it from the rooftops. That is why my skin is the way that it is because I introduce exfoliation, but I don't want everyone to do that. Not everyone is going to benefit from that. Not everyone needs that. And if someone doesn't need it and they do it, can that cause a problem? Yes. Over exfoliation is a real thing. Also, another reason why the fear is there. Because if you over exfoliate, you can run the risk of damaging your barrier. And your barrier is your skin's outer line of defense. It needs to stay strong and healthy for your skin to be healthy. So let's talk about that. So not all exfoliation is going to be created equal. So essentially there's going to be two types of exfoliation. You've got your physical and you've got your chemical. Physical is going to be mechanical exfoliation. So this is going to be physical movement. So this physically removes the cells away. So remember, you've got all those leaves. Think of this physical exfoliation being like you're coming in and you're sweeping all of those leaves away. You're just kind of sweeping them out of the way. So examples of this is going to be like facial scrubs, things like microdermabrasion, dermaplaning, other treatments in office like hydrofacial or diamond glow. Maybe you've got some cleansing brushes at home, silicone scrubbers, or if you're like the males in my family, they want to take wash rags and just like drag it across their skin. Okay. That means you're physically removing it away. I'm not saying that's the right way to do it. I'm just giving you examples of some physical exfoliation. So, what happens when we sweep away those dead skin cells? Well, you get immediate smoothness, which is why people love it so much. You also get like an instant glow because those hydrated, juicy cells are kind of at the forefront. So, the more hydrated cells are what we're kind of seeing with that glow in the skin. It also removes buildup. So, if you are someone that deals with acne or congestion or buildup, whiteheads, blackheads, this physical exfoliation is very beneficial to you because you're sweeping away all of it. But are there risks? Yes. If you're using incorrect scrubs, okay, things that are crushed walnut that are going to cause micro tears, you can get micro injuries to the skin. You can irritate your skin. You can increase inflammation. You can wreck the barrier. So it's very important when you choose a physical exfoliant, it needs to be rounded, not shards or crushed anything. It needs to truly be rounded. Think I want to sweep, not sand. Okay. Rounded things are going to buff and polish or just sweep away those dead skin cells. That needs to be the goal. Okay. Aside from physical, what else do we have? We have chemical exfoliation. And some people hear the word chemical and they think, ooh, it's going to burn off my skin. No, it's more of acids that are loosening the glue that are holding the cells together. Okay, so you have different acid options that essentially just loosen those cells together so that way they can exfoliate away easily. We're not burning skin off here. So, what are some of the different acids? I've talked about this before. I'm not going into great detail, but just kind of giving you some options. So, you have things that are alpha hydroxy acids, otherwise known as AHAs. These are water soluble. Okay, so these are going to be your glycolic acid, lactic, mandelic. You also have beta hydroxy acid. This is oil soluble. This is going to be your salicylic acid. But now there are some chemical acids that are becoming a little bit more popular because they are super, super gentle. And they're called polyhydroxy acids or PHAs. Popular again because they're super gentle. Some examples of this are gluconolactone. There's also lactobionic acid. So these are going to be milder PHAs. There's also enzyme exfoliants, also super gentle. So enzyme exfoliants, they are derived from fruit enzymes. So things like papaya, pineapple, pumpkin enzymes, these just digest the proteins. So they just kind of like disintegrate them very easily, very gentle. So it's not sweeping away, it's not breaking them up or pulling them apart. It's really just kind of like munching away, dissolving away all of those cells on the surface. So point of telling you this, chemical and mechanical exfoliation is helpful. Does every single person need both forms of exfoliation? No. So in my opinion, my humble opinion, who needs both? Who needs one over the other? And how do we decide? So again, first and foremost, I am giving you generalized information here. Your specific skin, because it is the largest organ of the body, needs to be trusted with a provider. Okay, moving on. So who could benefit from just chemical exfoliation? I would say more sensitive skin types, drier skin types, maybe diseased skin types, skin types that need a little bit more of a gentler approach. And frequency is going to depend on just how damaged, diseased, or dry, compromised, inflamed the skin is. So let's say your skin is super, super dry. I would say maybe 2 times a week with a chemical exfoliant is going to help. It's also going to help your skin's hydration because when you're promoting that exfoliation, you're getting the epidermis healthy. So that helps in getting your barrier repaired. So I would say probably a couple times a week with a chemical exfoliant is going to be helpful. Do compromised, dry, inflamed, diseased skin benefit from physical exfoliation? Yes. That even if their skin is dry, sensitized, compromised, inflamed, diseased, they're still experiencing a delay in natural shedding of the cells, and they're still experiencing buildup. Some diseased skin is acne, is rosacea, and they do benefit from removing those cells from the surface. So introducing a physical exfoliant just a couple or a few times a week can absolutely be helpful. But again, it's got to be the right physical exfoliant, okay? So who benefits from both? Like, how do we get both in there? Your girl, right here. Someone who has very oily, very thick, resistant skin, diseased skin with acne can absolutely benefit from both. And I benefit from both daily. Every single day in my routine, I am using both forms of exfoliation. But again, it's not always going to be helpful or beneficial for everyone. You have to really listen to your skin. You have to be able to pay attention to your skin, because there are some times when both forms of exfoliation are not helpful for me. So, for example, I switched up my retinol. So I went to a more aggressive retinol. Well, my skin became what? Drier. It became more sensitized. There was acute inflammation. So I started to back off of my chemical exfoliant while I was going through those aggressive reactions. So adjustments were made to my treatment to accommodate my skin in the state that it was in. And that is so important. I tell patients this every single time I recommend any type of exfoliant or retinoid or anything that is going to speed up that cellular turnover and sweep the cells away. Listen to your skin. So if you are going to be putting a patient on a physical exfoliant, maybe you're not sure, like, I don't know if her skin's really thick and resistant, I don't know, then tell them to start a couple times a week and increase as tolerated, and listen to your skin. If your skin is feeling sensitized, irritated, then you need to back off. If you feel like you've backed off and your skin is still irritated, still red, still inflamed, you need to get to the provider so you can put your eyes on the patient's skin and make recommendations for healing and loving on the barrier, because that always has to be where we are focused, because without a healthy barrier, the rest of the skin is not going to be healthy and you're not going to see results. Okay. Another thing, we mentioned this, but we have to talk about this. Let's say you put a patient on a really great program, they're on a great treatment plan, but they come back to you and you're like, what the hell? Like, I don't see any improvement. What is going on? I would encourage you to make sure that they are exfoliating, that you have some form of exfoliation, because if you're not seeing results, it's usually two things that you're dealing with. Maybe excessive amounts of oil, and oil is preventing penetration of those amazing topicals, or it's exfoliation, lack of exfoliation. They have lots of buildup, lots of congestion, and those products cannot perform because they can't really get where they need to perform at peak. So I would absolutely say evaluate which exfoliants or what exfoliant, or even if you have an exfoliant. Because let me tell you, what I'm seeing in the field is lots of moisturizing properties, lots of moisturizing products. Nothing wrong with that. Not really my cup of tea, but I'm not here to, like, give you any lip for that. Like, it's just not how I do it. But you've got hydrating toners, you've got hydrating serums, you've got really thick moisturizers, and there's no exfoliants in there. Think about those leaves on the lawn, and all you're doing is watering the damn lawn. What do you think is going to happen? Eventually, there's going to be a really thick, compacted mat of leaves. Nothing gets through that. And at some point, the water that you are watering the lawn with is not even getting through that mat of leaves. You can't just hydrate and not exfoliate. Come on, y'all. There's got to be both. Hydrate, exfoliate. Hydrate, exfoliate. Your skin needs both. Stop being so damn afraid of exfoliation, because then all you're doing is watering the damn lawn, and you're going to have a big leaf mat. You're going to have a leaf mat. Okay. All right. So there are other myths that are out there surrounding exfoliation. I got them gathered together for you, and we're going to address them now. Number one, exfoliation makes the skin thinner. Y'all got to be smarter than that. You've got to be smarter than that. That is incorrect. Why is it incorrect? Because the thickness of your skin is determined by the dermal layer. The dermal layer is where you have collagen, elastin, fibroblast activity, glycosaminoglycans for adequate hydration. That is what determines the thickness of the skin. When you are exfoliating the stratum corneum, which is what we're doing with physical and chemical exfoliants, you are not even addressing that. All you're doing is sweeping away the dead skin cells to regenerate the birth of new healthy skin cells. We are not wearing away at the dermal tissue. So incorrect. Okay. Actually, when you're exfoliating frequently over time, it can improve the quality of the epidermis. So very wrong information out there. And I wish we would stop. Again, this is why exfoliation needs a PR team. All right, next, sensitive skin shouldn't exfoliate. And again, this is, I'm going to say usually false, okay? Sensitive skin can often benefit from gentle exfoliation because it retains dead skin cells, and that can worsen inflammation. So even when you see sensitized skin, inflamed skin, they still have a delay in exfoliation. There is still a delay in the keratinocyte maturation cycle, and you need to introduce exfoliation. But what type of exfoliation? How frequently is the question. It's not don't do it. It's what exfoliation method should we choose that's going to be the safest for your skin and the state that it is in, and then how frequently should we do it? And keep your eyes on them. If you have a sensitized patient that is on any kind of exfoliant, keep your eyes on them. They should be checking in with you at least 6 weeks. All right. Acne means exfoliate harder. Okay, I think we've become more privy to this as a society. I think we're all getting a little bit more educated on this, that harder does not mean better. So in this, definitely not. You should not be exfoliating harder with acne. Aggressive exfoliation can increase inflammation, and it can even worsen the acne. So acne has to be treated with targeted ingredients, and not all acne patients are on the same grade or the same journey of that acne phase. So they need to be treated differently, and again, monitored by someone that knows what they're doing. You should feel tingling when you're exfoliating. Okay. If I don't feel it, it's not working. Not necessarily. Okay, guys, more sensation does not mean better results. So that doesn't always mean it's not working. You know, I tell people this, when you think about skin being compromised, the barrier being compromised, if I apply a glycolic acid, yes, you might feel a little bit of a sting, but let's say someone applies that same glycolic acid and they don't have a compromised barrier. It's nice and sealed. You've got tight brick and mortar. They may not feel it. It doesn't mean it's not working. It's still working in the skin. So don't gauge the efficacy of the exfoliant based on how spicy it feels on your skin. Okay? If your skin, this is another one, if your skin peels, it is working. Wrong. Wrong, wrong, wrong. So the thing is, there's different types of peels, okay, or ingredients that estheticians or providers can use to quote unquote peel the skin, exfoliate the skin. Some will actually cause true sheet peeling. So this is going to be things like TCA, things that are more aggressive for in-office treatment. But your alpha hydroxy and your beta hydroxy acids are not going to visibly produce skin that sheet peels, okay? Because again, what those acids are doing is they're loosening the desmosomal bonds that are holding the cells together. So when you exfoliate or peel, you are exfoliating a single cell here, a single cell there, and you cannot see that. So even though you're not seeing it, it doesn't mean it is not doing the job. You're still getting the loosening up of that glue, and the exfoliation is happening. It's just not happening visibly for you to see. So even if you choose the most gentlest of acids, they are still working. Okay. All right. So that's the myths. I would say this. Being afraid of exfoliation is absolutely silly, okay? Exfoliation is healthy. We just need to make sure we do it right. Because if we don't do it, we're not going to be able to sweep the cells away. You're going to get buildup, you're going to get congestion. But don't go at it alone, because the risk of over exfoliating is absolutely there, okay? So if you have over exfoliated, what should you be looking for? Well, I would say if you have burning, stinging, tightness in the skin, persistent redness, increased breakouts, flaking of the skin, products all of a sudden sting that shouldn't, like your moisturizers or hydrating things, and all of a sudden they sting, or any other kind of increased sensitivity, that usually means that there's some barrier disruption and you need to get to your provider so they can help adjust your exfoliating routine and get you back on a barrier loving protocol. Okay. This is the thing, guys. Don't be scared. You shouldn't be afraid. Nobody dies. It's just skincare, for crying out loud. If you go ham, there's always ways to rein it in, okay? As long as you're working with a provider, nothing is permanent. We're not killing anybody here other than dead skin cells. Pew, pew, pew. All right. Okay. How often should you exfoliate was another question that I had. Again, this is going to be very patient specific, but if you want something general, I'll give you something. This is going to depend on things like your skin type, whether you're dry, oily, normal, combination, if your skin is diseased, your age makes a difference, your goals, and then what other active ingredients are you on. All of those things are going to determine how frequently your provider is going to tell you to exfoliate. But just a general rule of thumb: sensitive skin, 1-2 times a week. Normal skin, usually 2 to 3 times a week, can increase as tolerated. Oily skin, thick skin, 2 to 4 times a week, but again, or every day, but this will depend on the type of the product. Okay. So daily exfoliation, yes. Can we do it every other day? Sure. You're going to have to do it depending on you. Your skin is not the same as your best friend's skin. It's not the same as your boyfriend's skin. It's not the same as your mama's skin. It can be the same as your mama's skin, but you all are going to need different things, and you have to have someone that knows what they're doing to recommend it and keep their eye on you. Okay. Other things, you have to make sure if you're going to be on an exfoliating protocol, because I get this a lot. People will say, I can't believe like you're using a glycolic acid and a retinol. I can't believe you're doing both of those things and then still using a physical exfoliant. Understand that the product line that I use specifically, again, not everybody uses the same product line. The product line that I use, yes, it has increased exfoliant properties. It has retinols in it. There is more of an aggressive approach to it. However, every single product, including the exfoliants, has anti-inflammatories, antioxidants, and hydrators and lipids. So it's not just constantly whipping my skin. It's also loving on my skin too. It's giving me lots of loves. So this works for me, may not work for you. You have to be able to be flexible, work with a provider, and look, it's a trial and error. I want to give providers just a little shout out here. You do a very hard job, really and truly, and you don't get enough atta girl or atta boy and credits, because as a provider, when a patient comes in, the provider is going to analyze your skin, and based on that consultation, they're going to recommend a treatment plan that coincides with their knowledge of your skin and their knowledge of the products and tools that they use. That is standard. I'm going to recommend I'm going to take this at face value, and I'm going to recommend a plan based on that consultation. But the patient's skin may get home and go, and freak out. We don't know. You have to be able to pivot, and that's part of this. It is a journey. None of this is written in black and white and is consistent from patient to patient to patient. It's not. It is a journey, and that provider needs to be able to walk with you on that journey. And don't give them a hard time. If they put you on a product and your skin doesn't agree, leave them, calm down. Okay, calm down. It's not their fault. They recommended it because of what your skin needed at the time that you were in their office. Your skin might not love it. Maybe there's an ingredient in there that your skin is like, I hate this. They wouldn't know that until it's on your skin and they're able to do it. So be flexible, be understanding. Okay. If it doesn't work, that's okay. Go back into the office, let them pivot, let them take a left instead of a right to try and help you on this journey to getting your skin healthy and achieving the goals that you want to achieve. Just make sure that exfoliation is part of that routine. Some way, shape, or form, you've got exfoliation in there. All right, guys, hopefully I served Exfoliation well as their PR team today. Hopefully you've learned something new, and hopefully it helped relieve any fear that you may have that surrounds exfoliation. Have a healthy understanding and respect, and know when to go one way, the other. Okay, that's all I've got for you today. Thanks for tuning in, guys, and until next time, bye. Think of the Skintrovert as your aesthetics roundtable, not a training manual. This podcast is for professional education and discussion. It's not medical advice. Your scope of practice matters, regulations vary, and your license always leads. To continue the conversation, follow the Skintrovert on Apple, Spotify, or any platform that you listen to your podcasts.